What will be the expected time of the complete slides?
Max 1 hour, sir. Total.
Max 1 hour. No? Yeah, actually, these are only 54 slides. So I guess it will be completed in very slow speed by 40 minutes, I guess.
Yes, yes, doctor. Yes.
Yeah.
बना भी
हाँ जूम पे
अभी इसमें यूट्यूब पे तो है ही।
हाँ शर्मा जी आ गया देखो यूट्यूब में।
गुड इवनिंग सर।
गुड इवनिंग शर्मा जी आ गया यूट्यूब में भी देखो।
अच्छा सर हम लोग अभी देख रहे हैं सर, एक मिनट।
और दोनों ऑन मत करना आप।
अच्छा 2 मिनट में हो रहा है सर?
नहीं बोथ डोंट स्विच ऑन बोथ एट द सेम टाइम, देयर विल बी अ बूमिंग वॉइस।
ओके सर, ओके ओके सर।
हाँ सर कुरकुर है ना?
हाँ सर कुरकुर यूट्यूब पे करना।
कैपिटल में तो नहीं है सी?
नहीं स्मॉल है।
अरे स्मॉल में ही है?
हाँ बॉस करो भैया करो।
कम करना है अभी आए तो सही, जब कम करना ना, जब आया ही नहीं अभी तो।
ये आ गया
आगे वो आपकी आवाज
आगे।
आपकी आवाज आ रही है क्या? आए तो सही, जब कम करना।
गुड इवनिंग डॉक्टर साहब।
हाँ जी, गुड इवनिंग, गुड इवनिंग।
ऑल द बेस्ट सर।
थैंक यू जी, थैंक यू
सर वेरी गुड इवनिंग।
गुड इवनिंग।
या शर्मा जी कैन म्यूट योरसेल्फ। शर्मा जी प्लीज म्यूट योर ऑडियो एंड वीडियो। Good evening, everybody. Welcome to everybody. Welcome all doctors. Thank you for sparing this evening with us. And I take pleasure in welcoming Dr. Mayank Gupta. Dr. Mayank Gupta is a senior consultant physician and diabetologist at Dhanvantri Hospital, Jaipur. And Dr. Mayank Gupta has done his undergraduation and post-graduation at SMS Hospital, Medical College, Jaipur. Dr. Mayank Gupta has got several national and international papers to his credit. And I'm sure you will enjoy the lecture by Dr. Mayank Gupta. Over to you, Dr. Mayank Gupta, for taking ahead.
Good evening, all. Thank you so much for the brief introduction. See, in such current pandemic of COVID-19 era, we all are dealing with new and new medicines day by day. We all are discussing about new opportunities, either in allopathy, Ayurvedic, homeopathy, or any kind of medicine or drugs or any kind of miracle from which we can combat this pandemic or which can help us in near future pandemics like any other viral illness or any other diseases which hit on our immunity. So in this step, one more further feather, following slides, we are discussing about that new potential drug. So the new immunoceutical. So sorry for the interruption. So we are starting with the introduction. As we all know, the immune system is an, just a second. Yeah, the immune system is an efficient integrated network of cellular elements and chemicals developed to preserve the integrity of the organism against external insults, and its correct functioning and balance are essential to avoid the occurrence of a great variety of disorders. As we all know, immunity is the most important thing to combat any kind of illness. To till date, evidence from literature highlights an increase in immunological diseases, and a great attention has been focused on the development of molecules which are able to modulate that particular immune response. There is an enormous global demand for new effective therapies, as I had already highlighted, and researchers are investigating in this new field. One promising strategy is the use of herbal medicines as integrative, complementary, and preventive therapy along with the whole treatment. Now, as we discuss some basic human physiology, immune cells and their roles, as we know, in our immune system, certain cells like macrophage, neutrophils, lymphocytes, eosinophils, and basophils, these all immunity or immunomodulator cells which acts at different spheres, like macrophage, which acts as phagocytosis and antigen presentation to T cells, and its main target is various in our body. Neutrophils acts in phagocytosis and pathogen degranulation, and its main targets are bacteria and fungi. Lymphocytes, it acts as immune response mediator, and it also works with neutrophils and pathogen cell destruction. Its main targets are virus, bacteria, infected cells. Eosinophils, it acts on parasites and acts by release of enzymes and cytokines. Basophils, they acts on allergies, allergens, and acts by release of histamines, enzymes, and cytokines. Now, another beautiful thing, free radicals. As we know, free radical, it can be defined as any molecular species which is capable of independent existence that contains an unpaired electron in an atomic orbital. Many radicals are unstable and highly reactive. These are highly reactive species which are capable in the nucleus and in the cell membrane of which damaging biologically relevant molecules like DNA, proteins, carbohydrates, and lipids. For example, superoxide anion, hydrogen peroxide anion, and hydroxyl radical. So as we can see in this slide, the mechanism of free radical scavenging. Free radicals, they attack on healthy atoms and destroy our immunity. In this scenario, antioxidants has a beautiful role which combat with these free radicals. As we see on the right side, a normal cell is infected by free radicals. And in the extreme right, we can see a cell with oxidative stress, a apoptic cell. So oxidative stress and immunity, as we can see, they go by hand in hand. Immunity and oxidative stress have a synergistic relationship. when there is an imbalance between oxygen free radicals and oxidant mechanisms, it can cause impairment of innate immune system. So these can result in impaired phagocytic and lymphocytic activity, compromised development of neutrophils, macrophage and NK cells, which in turn leads to weakening of our immune system as highlighted by this arrow diagram. What is the process of reduced immunity? When an oxidative stress hit our body, it will reduce immune response and inflammation, which leads to further infections. So, as we had talked about a new immunoceutical in initiation, so our today's talk is much more focused for curcumin and piperine, these natural derivatives from our own haldi and kali mirch, turmeric and black pepper. So, we are now highlighting on this in some detail. As we all know, curcumin is the chief constituent of turmeric, that is our own haldi in each and every kitchen of Indian scenario, which has proven to be of therapeutic importance. Its antioxidant properties plays a vital role in fighting chronic inflammatory conditions. Commercially available curcumin is a combination of three molecules together referred to as curcuminoids. Several preclinical and clinical data have shown therapeutic benefits in various human diseases. Not only this current pandemic, also including cardiovascular, inflammatory, metabolic, neurological, and various skin diseases. So what is the role in immunity of curcumin? Its effect on the immune system is one which is most studied from ancient times. Oxidative stress, which involves the generation of reactive oxygen species, is one of the major cause of dysregulation of immune response. This curcumin increases the serum activity of antioxidants SOD, that is superoxide dismutase. This is the step where it hits the immunity and boosts the immunity. Curcumin is found to be an effective scavenger of reactive oxygen species and thus preserves and promotes the functioning of immune system. Results have shown role of this curcumin in the immunomodulation as activation of T cells, B cells, macrophage, dendritic cells, cell cycle proteins, cell mediated and humoral mediated immunity. So what is the mechanism of curcumin? As we all know, it is the tested, time tested and trusted drug in our home remedies. So it also has the scientific role, scientific proven role. Curcumin primarily exerts its therapeutic effects by inactivation of natural factor kappa beta, NFKB. So inhibition of NFKB activation in turn leads directly to the inhibition of several pro-inflammatory cytokines. Example, tumor necrosis factor, interleukins 1, 2, 6, 8, and 12, which further reduces inflammation. Its secondary role by immune modulation, as we already highlighted, regulation of various immune cells, example T, B cells, macrophage, dendritic cells, and natural killer cells, which leads to immune modulation. So what is the mechanism of immunomodulation? Curcumin acts on T lymphocytes, natural killer cells, macrophage, dendritic cells, B and T lymphocytes, and all other types of immune cells. It regulates the immunity and it boosts the immunity. And several journals, national, international papers and credits to this curcumin for this role. Now we talk about piperine, that is our own kali mirch. So black pepper is one of the most widely used spices in the world with the family Peperaceae. So piperine is the principal bioactive compound of pepper to have immunomodulatory, antihistaminic, stimulatory, hepato, liver protective, anti-inflammatory, and anti-ulcer. So many roles which are accredited to black pepper only. So pepper is included in many traditional formulae to increase or enhance the effectiveness of other bioactive compounds such as curcumin and vesicin. So what is its role in immunity? Oxygen radical injury or oxidative stress and lipid peroxidation, they have been implicated as major mechanisms known to hamper or destroy immune system. Studies have consolidated that piperine protects the immune system against oxidative damage by quenching these free radicals, reactive oxygen species and hydroxyl radicals. Piperine, it also significantly increase, please focus on it. It significantly increased the gastrointestinal absorption of curcumin as it inhibits its hepatic and intestinal metabolism. So when we combine piperine with curcumin, it significantly increased the absorption of curcumin, and so several fold increase in the bioavailability of curcumin is there. So piperine acts as an agonistic action to curcumin in increasing immune activity. So as we already highlighted, and it increases the absorption of curcumin by increasing its bioavailability several folds. As in this slide, you can see numerous properties of our own turmeric, curcumin, curcuma longa, like highlighted antiviral, antibacterial, antifungal, antiseptic properties, antioxidant, as we already mentioned, anti-inflammatory properties, cardiovascular benefits, anti-cancer activities, IBD, its efficient role in inflammatory bowel disease, our own Alzheimer disease, osteoarthritis. So a numerous beautiful action of this turmeric, which is easily available in each kitchen. But the catch is its bioavailability. As we already discussed, bioavailability is only increased by piperine in a fixed formulation, as we all discussed in further slides. So the beauty of this turmeric curcumin is also highlighted in various international and national newspapers in the golden news. So like Indian Express, turmeric, the golden spice to the rescue during COVID-19. From the start of COVID-19, we are fighting with each and every discussion regarding any drugs, whether it is allopathic, homeopathic, or Ayurvedic. So these further consolidate the role of curcumin in boosting our immunity. So owing to its medical benefits and adaptogenic benefits, turmeric has a long legacy of being used as a healing and reviving spice. As we all know, it is an immunity boosting measure against COVID-19. So Ministry of Ayush has recommended various measures, and having turmeric is one of them. Financial Express. See, the finance is also interested in combating COVID. So use of power of turmeric and boost your immunity with curcumin. This is the headline in the Financial Express. So by renowned Dr. Saurabh Arora, immunity is our body's natural defense against disease-causing bacteria and virus. It can considerably reduce the odds of getting sick. So our immune system is getting affected with the widespread corona and novel viruses and other such pandemics since last centuries. So anti-inflammatory, antiseptic, antibacterial properties of this beautiful curcumin containing turmeric can contain these viral pandemic. In times of our own, times of India, turmeric health benefits are strongly highlighted, but there is one phenomenal spice sitting comfortably in every kitchen cabinet, as I had already mentioned, and that is the warm and traditional turmeric, a yellow colored spice that comes from the root of the curcuma plant. To fight this pandemic, it becomes essential to improve the body's natural defense system, immunity, to maintain our own optimal health. And it goes without saying that prevention is better than cure. Bachav hi upchar hai, as we already grown up from our nannies, dadis to eat healthy diet and have these things to boost our own immunity. Curcumin could benefit in COVID-19 treatment. Researchers, curcumin could at least partially prevent the entry as inferred from in silico docking studies. Studies has highlighted that it can also prevent the entry of cells in various target cells. A potential inhibitory effect on the main protease on the coronavirus is also reported in an in silico study in the literature. The multi-mechanistic modes of action are the fort of curcumin in various types of virus infections. It is not only boosting our immunity, it also having an inhibitory effect on acting of the virus on the target cells. So it is effective in pulmonary inflammation, fibrosis, edema, which we already combating in our day-to-day OPDs and in patients. We are having long COVIDs, post-COVIDs, and post-COVID fibrosis. So positive role of curcumin played out under the cytokine storm conditions during the second week of viral infections, which is also discussed. So there are some national and international clinical studies which will consolidate the role of curcumin and piperine in this current pandemic, and also to boost the immunity to combat with these kind of pandemics. Like in our own Elsevier Science Direct, there is an article published, Effect of Curcuminoids on Oxidative Stress. As we already highlighted, it has a beautiful effects in combating reactive oxygen species by increasing superoxide dismutase. Aim of the meta-analysis was to evaluate the efficacy of purified curcuminoid supplementation on plasma activities of SOD, catalase and glutathione, and lipid peroxidase as parameters of oxidative stress. In actuality, whether it decreases these things or not. So for this, there is a study as published in Elsevier, and these are the results. Forest plot detailing weighted mean difference and 95% confidence interval for the impact of curcuminoids on serum activities of SODs. As you can see in this, in the right side, It is favoring the curcuminoid's role in increasing the SODs. As I had already highlighted in the lowest portion, significant increase of serum SOD activities after curcuminoid supplementation. We can see like this, as we had seen its role in increasing SODs, it also significantly reduces serum lipid peroxidase to combat reactive oxygen species damage. In the similar manner, it increases reduced glutathione concentrations and boost our own immunity. It also increases catalase activity to fight against any invasive organism. As I had briefly mentioned, curcumin role in various other metabolic, cardiovascular, and Alzheimer disease. In similar fashion, it has beautiful role in knee osteoarthritis, our own aging bones. A randomized double-blind placebo-controlled parallel group clinical trial was conducted among patients with mild to moderate knee OA curcuminoids, which was given in dosing of 1500 milligram per day in 3 divided dose, matched with the placebo of 21 candidates for 6 weeks. So efficacy of curcumin versus placebo was measures, where changes were seen in WOMAC, visual analog scale, and LPFI scores. The results are in following slides. I'll go through these slides in brief, just highlighting the beauty of this thing. WOMAC index before and after treatment, we can see pain index, stiffness, physical function, global score, p-values. These all are decreased after treatment. Curcumin in knee osteoarthritis. It also reduces the frequency of the use of NSAIDs, as we already encountered with the patients in day-to-day practice. They used to speak, so we are taking such and such painkillers, over-the-counter medication, and that medications also has huge side effects on our body. So it is not only combating osteoarthritis mechanism, but it also reduces the frequency of use of NSAIDs or painkillers. There was significant reduction in VAS scores in the curcuminoids group by the end of the trial. So its role, as I had already mentioned, OA signs and symptoms were evaluated by WOMAC scores. Mobility was studied by walking performance, and inflammatory study was assessed by measurement of CRPs. And what is the end result after using curcumin? Number one, decrease in use of NSAIDs, decrease in GI complications, which is a huge toll. Patient used to come with severe gastric acidity, heartburn, retrosternal pain. It also causes decrease in use of other drugs, decrease in management cost. This is very important point. A decrease in management cost. As we are in India, a fighting nation, pocket compliance is very important. The thing is, distal edema decrease, hospital admissions, consultation tests, which are decreased after the use of curcumin. So it is clinically effective in the management and treatment of OAs. In this slide, you can see efficacy and safety of curcuma domestica extracts compared with ibuprofen painkiller in patients with knee osteoarthritis. So I'll go through fast in this slide. As I had already mentioned, it has beautiful results. You can see the highlighted p-values in mean score in 4 slides, total score, pain subscale, stiffness, and function subscale. All 4 are on the downfall trend after the use of curcumin after 4 weeks. What is the effect of curcumin on serum cytokine concentration in subjects with metabolic syndrome? See, in current pandemic of COVID-19, we are dealing a lot of patients with cytokine storm. So we are also seeking for a drug which can combat or halt this storm, cytokine storm syndrome. So following study highlighted the effect of curcumin. So it causes significant reduction in serum concentrations of TNF alpha, interleukin 6, TGF beta, MCP1. Curcumin supplementation significantly decreased the serum concentration of pro-inflammatory cytokines in subjects with metabolic syndrome. Similarly, it can decrease cytokine storm from occurrence if it can be initiated early in the patients of COVID-19. So it is a huge break. Role of curcumin as an antioxidant and anti-inflammatory. So in this study by Panahi Y et al., the objective was to use curcuminate preparation on measures of oxidative stress and inflammation in patients, and to estimate the effect of curcumin on plasma CRP concentrations. Curcuminates were administered at a daily dose of 1 gram and were co-supplemented with piperine, that is 10 milligram per day, in order to boost oral bioavailability. As we already highlighted, the role of piperine in increasing the bioavailability of curcumin. So what was the result of this trial? Curcumin was with piperine when used in in a combination, they significantly reduce the HSCRP and SOD levels as compared to placebo, and it can be an effective supplementation as antioxidants and anti-inflammatory. So Panahi et al. Also consolidated the role of curcumin and piperine. There's a review article in a reputed journal in which the role of curcumin in inflammatory disease was highlighted, and it was done in National University Korea. So I'll only highlight the role of curcumin. It is safe, non-toxic, and it will reduce the cytokine storm status, protein kinase, and enzyme, which will promote inflammation. In addition, curcumin induces apoptosis through mitochondrial and receptor mediated pathways, as well as activation of caspase cascades. In the current study, the anti-inflammatory effects of curcumin were evaluated. Along with that, a similar study, a pilot study, was done by Rafe Bundi et al., and it significantly emphasis on the role of turmeric or curcumin in IBS, inflammatory bowel syndrome. It may help reduce IBS symptomatology in a dose of 1 BID for 8 weeks. Similar to that, this is a pilot study, a randomized double-blind control study, which was done on the patients of mild to moderate knee osteoarthritis. In this study, to conclude, curcuminoids represent an effective and safe alternative for osteoarthritis, as we already mentioned that. In this reputed journal Elsevier, there is another article by Younes Panahi et al. Lipid modifying effects of adjunctive therapy with curcuminoids, piperine combination in patients with metabolic syndrome, results of a randomized control trial. And this trial also beautifully highlighted that findings encouraged the use of availability increased curcuminoid preparations as part of treatment regime in MS patients who are at a high risk of atherosclerotic, you can say ACVD. So present study provided the first clinical evidence on the efficacy and safety of adjunctive therapy with curcuminoids piperine combination in modulating serum lipid concentration of patients with MS receiving standard therapy. Mitigation of systemic oxidative stress by curcuminoids in osteoarthritis. It is also RCT, randomized controlled trial done by Younes Panahi et al. And it also shows short-term supplementation with curcuminoids. It attenuates systemic oxidative stress in patients with OA. So you can see there are a lot of data which is available to consolidate the role of curcumin as anti-inflammatory and to boost immunity. There's another RCT which was done by Younes Panahi et al. Again, and which shows and consolidate the short-term supplementation with curcumin and piperine combination significantly improves oxidative and inflammatory status in patients with metabolic syndrome. Curcuminoids can be regarded as a natural, safe, and effective CRP lowering agent. In this study also, it highlighted that supplementation with curcuminoids may reduce circulating levels of CRPs, which is a novel anti-inflammatory marker. The effect appears to depend on the bioavailability of curcuminoids preparation and also the duration of supplementation. So both the things are important: dose, bioavailability, and what is the duration of curcuminoids piperine combination. Curcumination is also used for radiation dermatitis. As we already seen, there's a beautiful role of haldi in various skin problems. So oral curcumin 6 gram daily during radiotherapy reduces the severity of radiation-induced dermatitis, which is a big breakthrough in breast cancer patients. Curcuminoid treatment for new osteoarthritis is also studied by Panahi et al., which also consolidated that treatment with curcuminoids was associated with significant greater reduction in WOMAC scores, as we already seen. Curcuminoids represents an effective and safe alternative treatment for osteoarthritis. What is the effect of curcuminoids on oxidative stress? Amir Hossain, Sahebkar et al. Also emphasize on the fact there is a significant reduction of serum lipid peroxidases and other pro-inflammatory markers. What is the in this trial? Investigation of the efficacy of adjunctive therapy with bioavailability boosted curcuminoids in MDD, that is major depressive disorder. This study highlighted that reduction in BDI second total score and scores of somatic and cognitive subscales were found to be greater in the curcuminoid group. So co-administration of curcuminoids with piperine may be used as a safe and effective add-on to standard antidepressants with patients with major depressive disorder. In the similar fashion, when we add piperine with the curcuminoid extract, it will increase the viability and majorly reduce the symptoms of depression if given along with the appropriate treatment. Effect of supplementation with curcuminoids on dyslipidemia in obese patients, RCT by Akram Mohammadi et al. It shows that 1 gram per day for 30 days leads to significant reduction in serum triglyceride concentration. As we already seen, it will decrease the lipid peroxidation, increase immunity, and reduce serum triglyceride concentration. This finding consolidated by this trial. The use of curcuminoids in a cohort of patients with oral lichen planus and autoimmune disease. So a wide spectrum of curcuminoids and wide and intensive research is going on, and already established role of curcumin in so many immunomodulatory disease. The one and beautiful example is lichen planus. What is the role of curcumin therapy in IBD? A pilot study, and we already seen in one more study. All proctitis patients improve with reduction in concomitant medication. This is also very important, as in IBD we used to give many drugs, and drugs have their own side effects. Those this will also ameliorate the symptoms and also decreases the pill burden. It also acts in Crohn's disease patients had lowered CDI scores and sedimentation rates. Curcumin as curcumin from kitchen to clinic, as we already seen our mothers, our wives in our own kitchens, the role of turmeric and use of turmeric in each and every, I guess, if I'm not wrong, if I'm not mistaken, in each and every Indian dish we used to use turmeric. So from kitchen to clinic, as this is beautiful by Ajay Goel et al, we are using now in our own OPDs and our own inpatients the role of curcumin, as you can only using turmeric in raw form in your diet, but its bioavailability is very poor. So you have to be use this in such formulations like we are discussing this curcumin with piperine, so that its bioavailability can be increased, so we can extract more and more benefit from that turmeric and in very small amount. So back to this article by Ajay Goel et al, a therapeutic agent with what, which is curcumin, a therapeutic agent in wound healing, diabetes, Alzheimer's disease, Parkinson's, CVD, cardiovascular disease, pulmonary disease, and arthritis, and never-ending list. Its potential role in IBD, ulcerative colitis, colon cancer, and such and such and such. A beautiful drug having a beautiful role. Its renoprotective action was also studied by Anita Saxena et al, which is who is a professor in SGPGI. So renoprotective role of turmeric in CKD. In CKD is, as we all know, in kidney failures, various inflammatory markers, pro-inflammatory markers, and oxidative stress come into role and will lead to more and more kidney damage and other multi-organ dysfunction. So it has beautiful role in combating these pro-inflammatory markers. These levels of TNF interleukin 1 were significantly reduced by the role of turmeric in CKD patients. What is the conclusion in this study? Curcumin might avoid the progression of renal impairment to the stage of CKD, end stage renal disease or cardiovascular disease, where either dialysis or transplantation is the only means of therapy. So from this, we can take home messages that we can use curcumin or turmeric extracts in very early stages of kidney or cardiovascular disease, so that we can halt the progression towards the dialysis or the transplantation. What are the saline features we already discussed? So I'll brief them all so that we can take home a beautiful memories from this talk, that this beautiful our own home remedy or home kitchen drug is very potential. Curcumin is known for its therapeutic benefits in various human diseases, including cardiovascular, inflammatory, metabolic, neurological, and skin diseases. Its antioxidant properties plays a pivotal role in maintaining immunity by increasing the serum activity of antioxidants, SOD. Piperine not only helps curcumin in reducing oxidative stress, but it also increases curcumin's bioavailability. Maintaining optimal immunity is vital in protecting ourselves from infections from various organisms. This is brought about by a balanced antioxidant and anti-inflammatory state. This is very important. To maintain our immunity, we have to combat pro-inflammatory antioxidative state, and to maintain this, we have to use any combination which will boost our immunity. Anti-inflammatory properties of the combination can be helpful in chronic inflammatory conditions like OA and numerous various benefits from this combination. Curcumin, back to basics. This is the natural. Please focus on that. This is natural derivative of turmeric, no synthetic, nothing. This is the natural extract from curcumin. Curcumin 450 milligram. It is a bright yellow chemical produced by turmeric, very own Curcuma longa. It is the principal curcuminide, natural principal curcuminide of Curcuma longa. And piperine is used in the strength of 5 milligram. It is extracted from our own kali mirch, that is black pepper. So which one to choose? This is our your own take. So many people used to say in our OPD, sir, agar haldi aap likhenge haldi, to we can take at our own kitchen. So for those people, this is a beautiful comparison and very easy thing to understand. You have to take 15 to 20. Please hear me carefully. You have to take 15 to 20 tablespoons full turmeric powder per day. This is very difficult to take because of low absorption of raw turmeric which we use in our own kitchen. So for that, to increase bioavailability and to boost our immunity, we just have to take 2 tablets per day. When we combine curcumin with piperine, due to its high absorption, we can extract maximum benefits with only 2 small tablets in comparison to 15 to 20 tablespoons for full turmeric powder per day. So what is the dosage of this combination as we are discussing? Only 1 tablet twice a day, 2 tablets a day, which can halt the progression of any immunity declining diseases and can halt the progression of chronic complications if we administer this beautiful drug in the initial times of the disease progression. What are the indication? Immense indication. There is no less required for the indication of haldi, curcumin with piperine. As we already know, from head to toe, you can use it in any kind of inflammation, infection, or any kind of chronic vascular diseases, chronic diseases, because it beautifully halts the progression of anti-inflammation and it halts the progression from going disease from mild to severe status. But if you just want some indication, these are for you. It boosts general immunity in cases of arthritis, infections, IBDs, CKDs, OSF, oral submucous fibrosis, and patients who are on chemo and radiotherapy. What is the side effect? Yes, every drug has its own side effects. I'm only talking about the beautiful things, but yes, it also has side effects. But if we use them in higher doses, so we are not advocating these for higher doses. If you use this drug as high doses of up to 3.6 gram per day, then you can have some diarrhea, headache, rash, yellowish stool, nausea, diarrhea, which we can evident from excess of everything is very bad. So if you are taking in excess, you can have these minor side effects. So this is the drug by Micro Labs for you. The combination of beautiful curcuma in 5 or 50 milligram strength with piperine 5 milligram, which you can take 1 BD in any kind of disease or to boost our own immunity, to enhance great immunity in OAs and viral infections as we are combating with this current pandemic. So you can use this curcupride in 1 tablet PD. Thank you so much. Thank you so much for your patient listening. I'm open to for any questions you want to ask. I'm there. You can have any questions. Ayangar Saab.
Thank you very much. The most common question, doctor, is that how long should it be used, which is the common question.
See, this is a beautiful question. As I can express my experience with you of myself only, I'm 35 years old. Since my childhood, I'm having haldi, I'm having black pepper. So there is no stringent lines. There is very narrow lines when to stop, when to initiate. You can have it for 1 month, 2 months, for 3 months, for 14 days. Like in this current pandemic, you can have at least for 2 weeks.
At least for 2 weeks.
Yeah.
Okay. Doctor, how would you rate it in other conditions like arthritis and?
See, I had already highlighted this in our my own presentation. This you can use it as immunomodulator and immune booster. You don't go to any kind of particular illness like osteoarthritis, CVD, CKD, because it will definitely help you. This is my take. This will definitely help you. And if you take in the early stages of disease, like early osteoarthritis, early CKD, early lichen planus, any autoimmune disease, or in CVDs, or in obesities, hypertriglyceridemia, if you take this drug in early stages for 2 to 3 months, it will halt the progression and your pill burden will definitely be reduced.
I don't think there are, doctor, any specific questions in YouTube. Let me just scan through it.
Okay, for sure, please.
Yeah, YouTube, there are no questions, sir.
Okay. Okay.
Similarly, in Zoom, there are no questions.
Okay.
So, thank you for the very enlightening session, doctor, and a knowledgeable session from your side. And thank you for all doctors who attended today evening session. Thank you very much, and please take care of yourself. Thank you, sir.
Thank you. Thank you so much.
Thank you, Doctor.
Thank you.